Guys, Dr. Brodsky here. This is month number 8 of your pregnancy. You're almost there. So you're 32 to 36 weeks of gestation. What you can expect right now is having more pressure as the baby drops. You definitely have a good size bump at this point. So this is a common time period for people to get maternity pictures or maybe 3D videos of their baby when their cheeks are nice and chubby and cute. So that's very, very common. You may also notice some more vaginal discharge, which is just cervical mucus that's kind of coming out at this point in pregnancy. That's very, very common and normal as long as there's no odor or discomfort with it. But talk to your doctor if it's watery or if you have any issues. Also, you may notice that your baby's movement becomes a little more subtle when the baby drops lower in the pelvis at 36 weeks. So this can happen anytime, but once that happens, the baby does have less room to move around. So he or she should still move 5 to 10 times every couple of hours, but it may just be a little different in the quality of the movement that you appreciate. So talk with your doctor if you have any concerns about it. Things to expect from your doctor around this month in pregnancy are, if you're a high-risk patient, sometimes we start antenatal testing at 32 weeks. Ante meaning before, natal meaning delivery. So some patients are more high risk and require more frequent visits at 32 weeks until they deliver because we're concerned about oxygenation for the baby for a various number of reasons. So that's not routine, but that's when this would start if you fall into that category. You also can expect to have a culture in the vagina, and it goes around a little bit on your bottom too, called a group B strep culture at 35 to 36 weeks. This tests for a very specific type of bacteria that just lives on some people's skin. If you do happen to carry and test positive for group B strep, then we treat it with an antibiotic in labor. Just let your doctor know if you have any allergies to medications. The other thing that can happen around this time is your doctor can start checking your cervix around 36 weeks. Sometimes we'll do it sooner if we're concerned about preterm labor, and sometimes we won't do it until the end because you may not be having any contractions. There's no medical reason to do it unless we think you're in labor or we're assessing you if you need to be induced. But many patients prefer their cervix to be checked because they're dying to know if it's dilating yet. The other thing that can be checked around this month is to make sure your baby is head down. 95 to 97% of babies find their way to be head down around this time by 34 weeks. So if your baby is one of the stubborn ones and your baby is breech for some reason, then your doctor will discuss that with you and give you possibly an option whether to try to turn the baby or do a C-section. But most babies behave themselves and are head down by 34 weeks. Ultrasound also, you should know, gets less accurate for fetal growth when you get further into pregnancy. So while some high-risk patients would benefit from getting a growth ultrasound on their baby every month, that's not necessary routinely because we know that we can't totally depend on that value just based on the ultrasound alone. But it's the best we've got, so we go by it. Things that you can be doing are discussing a birth plan if you have one with your doctor. You don't have to have one, but if you have specific questions or you have some concerns, go over those with your doctor. Make sure that you've cleared those up before you go into labor. The other thing to talk about is being clear on the hospital information and on the indications that your doctor uses to induce patients. You want to know what your doctor's practices are as far as their induction recommendations. And also you want to know where to go and what the call schedule looks like if you come into labor in the middle of the night. You want to know who's going to respond to that. So ask your doctor those simple questions. You can also ask about an epidural or pain management. Make sure you're pre-registered at the hospital and make sure your bag is packed because anything can happen at any point at this time. So in your bag, I usually tell patients, make sure you put plenty of comfortable clothes in there. The hospital is going to provide pads and diapers and wipes for your baby, but you definitely should have kind of like pajama clothes for yourself, comfortable clothing, slippers with tread on the bottom so that you can safely walk around and push your baby in the little isolette, in the little cart. And of course all the toiletry items you normally use. You can also bring fun stuff like the outfit you want your baby to go home in and things like that. So guys, that's it for month number 8. Thank you so much for watching this video. Check out my other ones as well, and I do weekly pregnancy videos too. You can find me at drbrodsky.com.